Snoring, where it comes from and how to treat it with surgery, by snoringcuresforyou.com, www.snoringcuresforyou.com. Snoring is among the most common sleep problems. While it is neither a debilitating nor death-threatening condition, it still causes some grave problems that may or may not directly come from its effects. Middle-aged men are mostly the victims, and there is high risk with obese persons. This is true since fleshy necks are most likely to have more flesh that would collapse during relaxed breathing. Snoring comes from narrowed air passage in between the throat and the nose. When we sleep, this passage narrows due to relaxation of the tissues. This explains why we only snore when we are in our most restful position. With a narrowed passage, the pressure of the air from the mouth and back are highly increased. Thus, this will drive the flapping muscles to vibrate more, which in turn create the snoring sounds. Anything that helps narrow the air passage and the muscles to relax will most likely initiate the vibrations. So, substances that promote muscle relaxation, such as alcohol, will encourage the tongue to fall back or the throat muscles to be relaxed from tension. A stuffy nose can also be considered as a culprit since it limits the space in which air can pass through. Thus, there are specific cases of snoring that only occur when one has colds or inflamed sinuses. Snoring can also be attributed to the position in which the patient sleeps. Sleeping on one's back will cause your tongue and throat muscles to be pulled back by gravity. Therefore, patients are advised to get used with a sideward sleep position. Since the only problem here is the unwanted relaxation of the muscles and tissues lining the respiratory tract, specifically the throat and the nasal passages, the most effective cure may be to remove any excess muscle through surgery. But surgery should be a last resort. An otolaryngologist will help determine what truly causes your snoring problem. He is a specialist in conditions that are directly linked with ear, nose and throat problems. He is the only medical authority that can create a thorough examination of your condition. The traditional method of surgery for snoring is the uvulopalatalharingoplasty or UPPP, which aims to widen the air passages. This process normally removes excess tissues that cause the narrowing of the throat, including uvula tissue, adenoids, tonsils and those that are covered by the pharynx. The more intensive version of this method, called laser-assisted uvulopalatalplasty or LAUP, uses laser in the removal of the muscles that inhibit normal air passage. Both methods normally work best for mild snorers and don't necessarily work for those who are suffering from sleep apnea or disruptive snoring. Nasal surgery, on the other hand, is recommended for patients whose snoring is caused by unnecessary blockage in the nasal septum. Tongue suspension procedure is a method that aims to keep the tongue from falling back. This is done by inserting a small screw in the lower jaw to which the tongue is stitched below. Shrinking of throat tissue is also a common method of creating solutions. Somnoplasty is a method that uses an electroneedle that releases energy to shrink the excess tissue. This then will be reabsorbed by the body. Surgery may not be a simple way of fixing your floppy throat muscles, but this procedure creates the ultimate solutions. Remember though that there are specific methods for specific causes. Be careful that you first discuss all concerns with your physician so that proper treatment is applied to you. From snoringcuresforyou.com, a short video about using surgery to fix snoring.